Believe, believe, believe.
Hey, Melissa.
Yeah?
Hey, I just found out my grandfather's Lou Gehrig, the famous baseball player.
Oh, maybe that's why you're such a good softball player.
Oh, thanks. The only thing is, he has ALS.
What's that?
ALS is called amyotrophic lateral sclerosis and is what happens when a mutation in the SOD1 enzyme changes proteins and causes your muscles to shrink, get smaller, and weaker.
I've heard of that.
The only thing is that because it is sometimes inherited genetically, members of my family now have to be tested for ALS.
So what's the likeliness that you'll get it?
Well, because only 5 out of every 100,000 people actually have this disease, it is kind of rare, and 10% of it is genetically inherited. Also, because 20% more males have it than females, I have a fewer chance of getting it than perhaps, say, my brother.
So what are the symptoms of this disorder?
There are quite a few of different symptoms, but I'm not quite sure of all of them. I'm going to go see an ALS specialist today to get some more questions of mine answered.
Hey, Dr. Eggers. Well, luckily you don't have the disease right now. However, it's more commonly shown in older people, so I have some information for you if this ever affects your life.
Okay. What age do many patients find out they have ALS?
Usually it's about age 50, and the life expectancy is usually about 3 to 5 years after the diagnosis. However, 25% have survived past the 5 years.
Okay, so this is a pretty devastating disease.
Yes, in fact, there's almost no treatment for ALS except for a drug called Riletec, which doctors are still not sure exactly what it does, but it seems to prevent the damage of some brain cells. Also, one might do physical therapy to try to regain some of the lost range of motion. Although this is scarce treatment, scientists are looking for new cutting-edge discoveries and are hopeful for the future in curing ALS.
Thanks!
ALS got its common name because of a famous baseball player, Lou Gehrig, had this very uncommon disease. The scientific name, amyotrophic lateral sclerosis, became because A for without, myo for muscle, trophic for nourishment, lateral for side of the spinal cord, sclerosis for hardening or scarring.
Common symptoms are difficulty breathing, difficulty swallowing, choking easily, difficulty getting up out of a chair, and going up steps.
Living with ALS would be quite difficult, especially how the life expectancy is approximately 3 years after you are diagnosed. Because your muscles eventually all stop working properly, having this disease is quite devastating. A medical caregiver should always be present because due to the fact that the throat muscles eventually stop working, choking is common along with difficulty breathing.
The genetic disorder is a problem with the gene itself and the enzymes involved. It is a mutation and it affects proteins and their ability to be made.
There are both sporadic and genetic forms of ALS. However, there is no particular population that it affects more than others, except more men having a 20% higher chance and some with a family background with the disease.
ALS affects about 5 out of every 100,000 people.
It is a gene disorder and is a mutation in the SOD1 enzyme.
Many scientists and doctors, such as Dr. McKee, are working hard to try and find a cure for ALS. Many researchers have great hope for finding a cure in the future, and many are working on antibiotics to help lessen the symptoms.
There are both sporadic and genetic forms of this genetic disorder. Although ALS is sometimes inherited, only 10% of affected people actually have genetically inherited ALS.
Symptoms include weakening of the body and losing almost all strength in the muscles. Also, many people start having trouble swallowing, which usually leads to choking easily. For safety reasons, once someone is diagnosed with ALS, a nurse should always be with you once the symptoms become severe.
If you didn't believe